So this is quite an interesting x-ray of a little dog that we've seen, a little Pomeranian, and the dog's come in because it's not walking properly on its left hind leg. Now this dog's about 11 months old, and what we can see is quite a difference between the hip joints on both sides. So this is the normal right side where we've got a normal ball and socket joint, and we can see over on this side the hip joint is completely abnormal. And what this is, it's a condition called Legg-Calvé-Perthes disease, where basically the blood supply to the head of the femur, so this bit up here, dies off, and we're not quite sure why that happens, but we end up with a situation where the bone dies off, becomes very weak and crumbles, and we end up with this situation where we get a lot of fractures within the joint. So this is a pretty nasty sort of thing to have happen, but it's something we can treat quite well. Being a small dog, they do quite well if we actually remove that hip joint. Sorry, it's just gone onto screensaver. So what we're going to plan to do is on Monday, we're actually going to remove the femoral head and neck. So basically taking the head of the femur off, and it effectively creates a situation where it's a muscle joint that's going to be supporting that limb, so much the same as the front leg of a dog, which doesn't have any sort of bony attachments to the rest of the dog. We're going to create the same situation, and this dog should go quite well with that leg post surgery.